right. Which of the following best explains the underlying pathophysiology in this patient? 45-year-old man with a history of MS presents with sudden onset vision loss in his right eye, reports objects appear dimmer in the affected eye, especially in low light conditions. Ophthalmologist performs a swinging flashlight test, notices that when the light is shown in the right eye, both pupils constrict, but when the light is swung back to the left eye, the right pupil paradoxically dilates, which is fine. Okay, let's see. Okay, so I'm thinking MLF with multiple sclerosis. Okay, right eye, let's see, light shows the right eye, both pupils constrict, going back to the left eye. That one dilates when it should be constricting as well. I'm wondering if that is afferent or efferent. That's what I'm trying to think of. So the sensory information is going to be afferent. That's what's going into the left eye. And there's something wrong here with the right. Both pupils can constrict though. Let's see. Both pupils can constrict. I'm wondering then if it's something with the efferent, not the signal. Because if the right eye can constrict, it's not saying it can't constrict and it's fixed, which would make me think efferent. Yeah, so I think I would go afferent, although with MS and stuff, I usually ask about like MLF and stuff like that, but
Okay.
I'm not super confident with this either. But yeah, afferent.
Yeah, 100% correct. So
Okay.
I like how you work through this. So let's kind of make it a little bit more clear for your mind
Okay.
here. So anytime you get multiple sclerosis, you're worried about optic neuritis, right?
Yes.
So inflammation of the optic nerve, which is your optic nerve or cranial nerve 2, right?
Hmm.
Deals with sensation or the sensation of light into your eyes, right? Which is kind of seeing light, right? Or interpreting light or seeing light, as I say, right? So that deals with the afferent limb, right? Because if you have
Yes.
optic neuritis, then that nerve cannot sense light, meaning that the afferent side, meaning the information going in, is broken, right? Which means that
Okay.
left eye, right? The left eye is not sensing light, meaning it cannot constrict the right eye, right? Because remember that they both kind of, if how do I say this? The eyes work in conjunction, right? So if you
Yes.
shine light in the right eye, they both will constrict because of the crossover, right? So
Yes.
in this sense, right, they shine the right eye, they both constrict, meaning everything's intact, right? The afferent, the efferent, right?
Yes.
Your
That's all
muscle,
working. Yes.
all working. But then the left eye, when you shine it, none of them will actually the left one won't react and the right one will dilate because there's no light shining in the right eye, meaning that there's no good crossover and the afferent
Right.
limb of the left eye isn't working.
Okay.
So, but yeah, that's kind of how it works. But yeah, you did
Okay.
exactly kind of work through it pretty well. But does that make sense about the optic neuritis for MS?
Yeah, that makes more sense with
Perfect.
optic neuritis.